Next up, we're going to talk about what to do with the swollen calf and knee 10 days post-op.
So I'm going to talk about a swollen knee after a total knee. This is a case presentation, a 51-year-old gentleman who had a total knee about 10 days prior, some comorbidities, some pain, about 1 out of 10 at rest, 5 out of 10 with activities, some edema, no shortness of breath, no fever, no calf pain, but unable to participate in physical therapy because of the swelling. On exam, real no calf tenderness, all pulses were normal, incision looks benign, no signs of infection. There was about 3+ pitting edema in the lower extremity and significant limited range of motion due to the swelling. The workup, duplex ultrasound showed no DVT, no Baker cyst, no popliteal aneurysm. X-rays showed no fracture, no loosening, no complications related to the surgery. So this is a patient with lower extremity edema as a complication of ipsilateral total knee. So my approach to this patient uses an innovative piece of technology. Obviously, the normal things that we all do is elevate the leg. We make patients walk, participate in physical therapy, mobilization, but use this device called the Gecko device, which is a device you see on the patient there, and also I treat all my patients with aspirin. We know that postoperative swelling occurs about 6 to 8 days after surgery and can sometimes continue on up to 50 days after surgery. And we know that swelling can affect physical therapy, affect our ability to walk for range of motion and mobility. So there's a vicious cycle that can cause also muscle inhibition. And there's lots of research showing that when you have swelling in the extremity, not just intra-articularly, but the whole extremity, you can have muscle wasting, you can have muscle weakness, and that can cause reflex inhibition and cause a poor outcome. So what is the Gecko device? The Gecko device is a very elegant device, lightweight, disposable device. It's placed on the lateral portion of the leg. It stimulates the peroneal nerve, which stimulates the lateral compartment of the lower leg to increase venous return and decrease swelling. It's lightweight, it's portable, it has a 24-hour battery life, it's easy to use, and it's very comfortable for patients to use. They can walk around with them, they can sleep with them, and they'd be on the extremity for 24 hours. Research shows that the increase of venous return with the Gecko device is about 30% greater than sequential devices. And when you look at microvascular circulation, because you're increasing venous return, you're increasing the microvascular circulation to the lower extremity. So there's a potential for increased wound healing and better perfusion of the lower extremity. When you look at the edema, this is comparing to compression stockings. The Gecko device shows a larger decrease in swelling of the lower extremity compared to compression stockings, and also higher patient satisfaction, higher patient comfort compared to compression stockings. All of you that use compression stockings get that complaint from your patients that they can't, it's very difficult to put them on, to take them off, especially with bathing. So we know that edema causes muscle inhibition. It causes an impairment of muscle strength and power. It affects the recovery of patients. It affects their independence. It increases hospital visits and possible need for surgical revision. We know that 95% of total joint patients have soft tissue edema. And this is kind of the thing that goes undiscussed among orthopedic surgeons. It creates difficulty with range of motion, difficulty with rehabilitation, and mobility. About 200,000 patients go to emergency rooms every year with lower extremity edema. They get unnecessary tests, unnecessary Dopplers, and they sometimes get admitted because it's unclear what's going on, and sometimes it goes to a hospital that's not the hospital that you work in. So I think the Gecko device can effectively prevent and manage lower extremity edema. It can improve, has the potential to improve outcomes as far as range of motion, movement, and independence in patients. Thank you.